All
No
right,
problem.
she's running across the driveway, and a car just so happened to bump her as she was running across the driveway.
The car
So
ran over my foot in the driveway,
or
my
could
left knee.
you explain me the pain on your foot real quick, like 1 through 10?
A 7.
7?
It's a heavy car. Did you check the specs on the car?
Extra. I'm here assisting it because the driver was me, and I did not see her coming at all. I was invited by Anthony Moore over there, and our fellow doctor Trey West had somehow dissipated and disappeared. I was driving his car, was trying to pull it out and about to close his doors. Soon I did that and got in Trey West's car. She ran across there, nowhere, out of nowhere. Boom, she got bumped. So,
Sure, blame the pedestrian.
hey, where did you come from? You was like a deer in the headlights. The way you just came across there, you wasn't even
Oh,
supposed
my
to be
head.
running across
Oh,
there.
my head.
It was a
Oh,
moving car. It was a
oh, my
moving
head.
car. It's a
It's my
driveway.
fault now. It's my fault
Oh,
now that
I'm
you
not
hit me with a
saying that.
big,
I'm
heavy
not
vehicle.
saying that. I'm not saying that, ma'am. It's just like if nobody, no one is at fault. Yeah,
Thank
check
you.
her hip and rib area in her left arm, cause I think she's running her left side. Check her left arm, rib area, hip, pelvis, and all that. It was a bump, but it wasn't a hit, but like a plow hit. She got bumped and got knocked down. She got bumped and knocked down, but we still need to look at that.
All
Did
right.
you
So
get
what am
hit or I got hit? Because now I'm confused. I'm really confused. Did you get hit or I got hit? I know what
No,
I'm feeling.
no, you are the, no. We know
All
you
right.
got hit. We're not
All
saying
right, Reen.
we
So
know
what I'm gonna
you
do?
got.
What I'm gonna hold on, Professor. What I'm gonna do is I'm gonna give you a shot that should take some of this pain away, and it might make you a little sleepy, but that's just part of the side effects. It'll take some of the pain away.
I don't like drugs. I won't be addicted, right?
No, it's not addictive or anything. It's not an addiction
Okay.
drug.
I don't like needles either.
On the scale of your pain, from 1 to 10, what's your pain level?
7.
That's why he has to give you what he's offering you right now.
Yeah, so it could calm your nerves and stuff.
Okay.
All right, that should take about 5 minutes to kick in. And so for your back, if you could take your sweatshirt off, I'm gonna check out, see if there's any bruising.
Yeah, there are
Take the
abrasions. I
sweatshirt,
see there are
Anthony.
abrasions. Yeah, there are abrasions from the bumper of the car. Yeah, there are abrasions on it.
Okay.
So, do you want to think about steroid shot or something, Doctor Bird? There are abrasions from when the bumper had bumped her.
Yeah, I might have to give her one for that. So did the bumper hit you in the back or?
No, the car, the wheel rolled over my legs when he tried to reverse and I fell down.
Yeah, we're gonna have to get some X-rays when we get back to HP for your ankle, for and for your back as well. But it seems
Okay.
like there's some bruising on your lower spine. So w- w- let me ask, what's your pain 1 through 10 on your back pain?
Like a five. It's not that bad as my knee.
So you saying more is your knee than your foot?
Yes.
You got a crack in your your ankle, and then we're gonna check your spine as well.
Okay.
Hey, I want to run an MRL on there in the ARL, see if she might tore some tendencies in her knee. Is that okay with you, Dr. Burt?
Yeah, that's okay with me.
I want to check on the tendencies in that knee. If she have knee problems, it might be an MCL or, it might be, there's a lot goes on the knee. So I need to check that out right quick. So, Dr. Burt, on the knee in placement, the knee bone is still intact, but it's a lot of bruising. It's just because it was a bump, but luckily it wasn't a hit. So it's just she's gonna be sore for a couple of days from the
Yeah, and
swelling, bruising. It's a bruise.
yeah, if there's any fractures in the leg.
Just okay, just some bruises from what I'm seeing.
All right, so
Okay.
Reen, could you step over here real quick? Yep, just right there. They're looking pretty good besides one of them. All right, so Reen, I did find there's some good news and there's some bad news.
Not the bad news.
Which one would you like to hear first?
Let me think about it. I have the bad and then the good.
All right, if you want, I can give you the bad news and then good news in the end.
Yeah, I'll work with that.
And man, we offer a great therapist program and everything that we offer also in Glendale and everything. If you feel free, if you want to sign up, I mean, we can help you get through this emotional distress.
Okay.
Professor, if you want to look at these sheets,
All right, check the charts out.
there is a little fracture.
Yeah, there was, I said it was a hairline fracture. Yeah, I saw that. It was a hairline fracture.
What
You
do you
know,
mean hairline fracture?
finish her up. The bones itself is gonna heal behind a hairline fracture. It's gonna hurt a little bit, but you have some pain medicine as far as to keep down the pain of it. But the bone is gonna re-heal itself, on the hairline fracture. But as long as it was good, it wasn't a major fracture from actually being hit and plowed by a car or anything like that. So the hairline fracture it's gonna re-heal. She's just gonna be on pain for a couple of weeks. Just prescribe enough pain medicine for her, and she should be fine. We'll give her a follow up to make sure all the pain is gone, and sh- we'll see how that progress. But
All right, so
the
all right,
bruising and
so
be gone in like a week or so. The bruising and abrasion, she'll heal back up and look back like her normal self.
yeah, like what Professor said, the bruising is gonna be there maybe for since it was like a little severe little incident since you got ran over where your foot did at least, and then you got that little back pain. So the back pain, what we what the results are basically saying is those bruisings and the pain will be there for maybe a few weeks, but the bruising should die down in like maybe 3 4 weeks. But if any of your pain starts
Her toes and all that. So she's fine on that part too, from what I'm seeing on the computer show. And
yeah,
all that. Or-
yeah, because she walked over here perfectly fine and stuff.
I don't think you guys was watching. I didn't walk perfectly fine, but okay.
Well, well yeah,
But we
not
gotta
perfect.
put a spin on it. We're gonna wrap it up. We're gonna wrap your foot up just for safety precautions.
Okay.
All right, so I'll be right back. I'm gonna grab that wrapping. But like Anthony, the assistant over here, he said you is gonna need CT scans. So just bear with us.
Okay.
All right.
Okay.
I mean, it's so great you still able to wiggle your toes, but they're gonna swell up a little bit. But we're gonna have you wrapped up and everything. Wrap your ankle up, but it's not broken. It's just sprung. It was a sprung. So you okay on that part. You'll still be able to do your gymnastics, cheerleader, whatever you want to do. You can do whatever you want to do. Once the swelling goes down, it's just sprung a little bit, okay?
So, as you know, my job description, I have to stand on my feet for the whole entire day. So, how does that go? Am I able to stand? Because it's going to be swollen and I'm on my feet like 8 to 12 hours for the day.
Well, within this wrapping, if you want to sit on the crutch, you can. We always have a crutch program. But it's just a swollen not to put so much pressure on that foot right now. It's just sprung. But sprained ankle doesn't really last long. So it's all about you and your ability and how fast you heal, I guess you can say. And you should be back running and flipping and jumping like back in normal in a couple of days. It's all about your, ability, I guess you could say, after your sprained ankle. It's just a sprung ankle now.
Okay.
All right. So I'm gonna wrap your ankle, and I'm gonna be real careful.
Okay. I hope you're more careful than Professor over there. Ouch.
Yeah, my fault.
Sorry, I'm a bit handsy. It's just doctors just doing what doctors do. But she wanted a more delicate doctor, so that's why she requested you. Mr. Moore here, he know I just see patients on the average. I see so many patients, so excuse me if I'm more handsy than, like forceful. Yeah, I want to see my patients go in now. Sorry, but Mr. Bird got you. He's more delicate. He's new to all the patients. He's a new doctor, and you guys should love him.
I actually have good experience with Dr. Bird.
Yeah, I just been here 35 years, so it's okay.
All right, we're gonna try the fourth time.
Okay.
Yeah, from what I'm seeing, yeah, she's gonna be okay. Yeah, she's just the bruising and the sprained ankle. She'll be her normal self back in a couple of days. From sprained ankles on her, she got to put enough pressure on her, but not too much pressure on it to get it back to working on sprained ankle. And the bruises should fade away in like a week or so.
Hey, professor, could I have some assistance?
All right, what do you need, sir?
No, 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 no. Mm-mm, mm-mm. Can I have Mr. Anthony Moore, please?
All
But
right,
he's
Anthony. Well,
really because I'm the one that. Okay. All right, Mr. Moore
Yeah,
can
I
go.
don't think
Mr.
that's
Moore,
safe.
Mr. Moore, can you please assist her?
I just got a bit of shaky hands. You know.
Cause she's almost ready for a discharge now at this point. So, cause we done already analyzed everything, we've seen everything. So it's not really no longer to really hold her now at this point. You can put the splint on her ankle, and we gave her prescribe her medicine for the pain, and we informed her that the abrasions and bruises will be going away in like a week or two.
All right, Carter. So,
Hmm.
so what I'm gonna prefer, well, what we prefer, s- specifically me, I'm a what it was. I'm gonna sign you over to therapy for maybe a month. But we're gonna do recent
Yeah,
checkup.
because
Like,
it was a traumatic experience. Yeah, it was traumatic.
yeah. So
Okay.
we're gonna do checkup maybe on the 15th, and then we're gonna do another checkup when you come back on the 30th and
Okay.
see how things are going and just give us results and but what I'm also going to do is I'm going to prescribe you some painkillers, and since you don't like shots really, I'm going to just prescribe you them pills if that works for you.
No problem.
Again, I'm so sorry though. I'm paying all the bills. So don't worry about your medical insurance, nothing like that. I'm paying everything.
One-stop destination for your favorite music. You're listening to Pure Music 104.3 FM.
More, did you set this up? You need to come back to work more.
Oh. Hey, Carter, do you got your insurance card with you by chance?
No.
Ah. All right, I'm gonna run your name real quick if that's all right with you to check your insurance.
Okay.
If I got your consent at least.
Yes.
All right.
Get her submit papers together as well while you doing that back there, sir. Yeah, those 6 hours ain't came fast enough. You need to get back to work. We need you back at work more. We need you more. We need you more. Hey, look, you're a cooler character than the character you bought. I'm sure you spent some money on that character, but yeah, you got a cool little character though. Much better than Connor's. And when Connor came in on his vacation, like he was like, no. But your character's pretty cool though. Yeah, you got the glasses on, I see the watch, I see the hat and everything. I'm sure you bought all of that. So yeah, you look pretty good though.
It's still good till next year, so she's got plenty of time. get caught up on.
Oh, don't
Mm.
worry about insurance. I'm doing it. I'm doing it. This pro bono off of me.
Yeah,
I'm
yeah,
paying for. I'm
yeah,
paying for
Professor.
everything. I'm paying for it
Yeah,
all.
what Professor said. He'll take care of you. He'll get that coverage so nothing comes out your pocket, and your insurance don't get used. But you're you is still good till next year. So, but I
Okay,
did, I
thank you.
did,
That's nice of you.
yeah, no problem. But yeah, I sent email over to the clinic, well, the therapy place, and I'm pretty sure they'll accept you because you got to get in there. You got to get things fixed up. You got to get back in shape.
Okay.
But Professor or Anthony, do you got anything? And you, Professor?
Uh, nothing I can add in it because I'm saying the embracing and you already wrapped her up. It's just a sprained ankle, so she'll be just fine in a few days. She'll be back to her happy cheery self. Off the meds you got her on, what you guys prescribed her, she's fine. It's just a little bump, nothing. We were so glad that she didn't get ran over or anything like that, but it was just a bump over bumper. So the bruising and abrasions that we see on the computer, she's okay on that. That'll heal up pretty soon. And that ankle that she felt like she got ran over, no, it wasn't. It put a lot of pressure on her for her getting knocked down. So you already wrapped it up as far as just it was a sprained ankle, type of thing, to where yeah, she's good as far as anything professional can say to you guys.
All right, and yeah, Professor, be a little more careful, driving and stuff. So,
Yeah,
so we,
hanging
so
out with my friends is on vacation, and then they brought them over to the house that we was at, and I was pulling out with a friend's car, who we didn't know how he died or whatever. That man died, but he was gone, and I was able to drive his car. I was trying to pull his car out. That's all I was trying to do. Was just like, and I
Oh,
was telling him
be a
like,
new car,
I
you
was
don't
telling
know
him
how to
like,
drive it.
it
I
was Trey.
understand.
Anthony was right there. He's my witness. And I was like, Anthony, I can use Trey car. Like, it's driving. And soon I pulled out Trey's car. It was finna get out and close his passenger door. That's when she ran across there in the driveway and got bumped by the car. I wasn't even driving the car. It wasn't even going like 10 miles per hour, 7 miles per hour, nothing like that.
It's a
That was
heavy car. The car
bumped.
is heavy.
That's why she got the bruises and abrasions, just a sprained ankle. I wasn't even driving on the road or nothing like that when she was running across the road, like why did the chicken cross the road type thing, or
I was
whatever. Like
going up the steps. I wasn't running across the road. I was
I
going
know
up the
I
steps.
said it. I said we're not saying it like that. It's just he was running across the driveway when I was telling Anthony that Trey has left his car, and then I
So
got in the
you
car.
admit you wasn't paying attention of what was going on. That's what you're telling me?
Wow, we got a committee over
Okay,
here.
so
Wow,
uh,
wow,
I
what's
apologize for
happening?
interrupting. We're leaving.
Hello, you guys. Miss Carter. Miss Carter. It was just
Professor.
simple. You was running across the driveway when I was trying to move a car out of the way, out of the driveway. And you just ran across and it got bumped.